I'm Dr. Lenin, Chief Orthopedic Surgeon, Dr. Lenin's Orthoindehospital, Chennai. I'm going to discuss about one of the greatest challenges the society is facing today, namely arthritis of the knee joint. Yes, above the age of 50, 1 in 2 women and 1 in 3 men suffer from this crippling disease. Though there are different types of treatment options available to treat this disease, the results are not uniform. The aim of this video is to educate and guide you in selecting the right treatment option. What is arthritis? Here in this model of the knee joint, you can see the specialized tissue called hyaline cartilage covering the meeting ends of the bone. The wear and tear of the hyaline cartilage exposing the underlying bone is known as arthritis. What are the causes of arthritis? The first and foremost, it is aging. Age-related degenerative arthritis or osteoarthritis, followed by rheumatoid arthritis, which affects young women, characterized by multiple joint involvement and early morning stiffness. Here the disease progresses to destroy the cartilage and results in arthritis of the knee joint. Next in the line is gouty arthritis. When the serum uric acid level increases in the blood, it gets deposited inside the joint and slowly destroys the hyaline cartilage or the articular cartilage, resulting in arthritis of the joint. And less often, a neglected trauma to the knee joint can result in arthritis at a later date, which is called post-traumatic arthritis. Here, in today's discussion, we will be talking mainly about osteoarthritis of the knee joint. Now, what are the symptoms? How do you know that you are suffering from arthritis of the knee joint? Well, if you have the following complaints like pain and swelling in the knee joint, stiffness, progressive deformity and loss of function, I am sure you are suffering from arthritis of the knee joint. And let us now see what are the various stages of this disease and how the symptoms vary from stage to stage. In the early or mild arthritis, these symptoms are precipitated by severe exertional activities and relieved with few days of rest. But when it comes to moderate arthritis, the symptoms are seen with daily activities of living and they hardly die away or disappear, lasting for longer period even after rest. Whereas the advanced or severe arthritis, you see the symptoms are persisting throughout the day, irrelevant to the activity level. To be in a nutshell, we can say as the disease, arthritis advances, becomes more and more severe, your functional ability shrinks and almost comes to a point of standstill, wherein you become either bedridden or wheelchair bound. What is the treatment? Now let us see the various treatment options for this arthritis of the knee joint. When it comes to early or mild arthritis, each and everything works as a treatment. You name it, the pain medications, physiotherapy, massage, acupuncture and whatnot, because here in this stage, predominantly it is the rest to the joint which heals or which gives relief from the symptoms. And at the same time, as the disease symptoms are brought in with exertional activities, the most of the treatment in this stage of the disease lies within the hands of the patient. You should avoid exertional activities like cross-legging, squatting, climbing stairs, treadmill, and long walk, running, and so on. What you can do is non-weight bearing exercises like cycling, swimming, and even walking within the pain limits. Sometimes you may need cartilage protecting agents to strengthen the cartilage. And here in this stage, with such treatment, the patient becomes symptom free for quite some time until another severe exertional activity brings back the symptoms. But when it comes to moderate arthritis, as I already explained, the symptoms are there with daily activities of living. They may not disappear just with the various treatment options which I enumerated before. Here you may need an intra-articular injection or even an arthroscopic debridement or a keyhole surgery to clean up the joint to have a temporary relief. Kindly note, a temporary relief. In a stage of moderate arthritis, even after an intra-articular injection or even after an arthroscopic surgery, if you do not have relief from the symptoms and the symptoms are bothering you, or you are suffering from severe arthritis of the knee joint, the only way out of this crippling disease is total knee replacement. Unfortunately, people still tend to try out various treatment options even in the advanced stages of the disease, because some of his relatives or their friends would have had good relief from these procedures, but they would have been in the early stage of the disease. The same will never apply to a person who is having severe arthritis. It is purely going to be a waste of time, energy, and money. Why do they do this? First of all, because the mere word of total knee replacement creates fear in the minds of the patient. That is purely due to two major concerns: pain and prolonged recovery after the surgery, and limited lifespan of this artificial implants. What is done in the total knee replacement? The worn out cartilage is replaced with the metal alloy on either sides of the bone, and a synthetic cushion is used in between, as well as on the undersurface of the kneecap. So this is what is called total knee replacement. As a knee specialist, I started pioneering a solution to these two major concerns, namely, once again, the pain and prolonged recovery and the limited lifespan of the implant. Let us first understand why there is pain and it takes long time to recover from this total knee replacement. In a normal knee replacement, the surgeon makes a long incision in front of the knee and he cuts open the thigh muscle which is in front of the knee, called quadriceps, which is the powerhouse of the knee joint. The moment you cut open this muscle, the patient loses the strength in the knee, and it takes a long time, many months for them to regain the strength, and that is the reason they struggle. They struggle after the surgery to recoup. It requires painful physiotherapy for many months. So it makes sense if you can do this surgery without cutting this quadriceps muscle. It can help the patients to retain the power in their muscle, and they may do well after the surgery. So this thought came into my mind decades back, very early in my practice, and I adapted a technique called a subvastus approach, or a muscle sparing technique. Ever since I started doing that, I was amazed to see my patients able to walk the same day, few hours after the surgery, and recovering completely within 2 weeks post-surgery. So I was quite happy I could find a solution for the first concern. But the second indeed was the lifespan of the implant. A normal implant, we call it as a fixed platform, lasts near about 10 years. When we saw younger patients in early 50s or late 50s, we were reluctant to offer this total knee replacement to them because they may need another surgery very soon in their late 60s or early 70s. So I started hunting for a solution. Well, I thought implanting these metal alloys with precision can improve their longevity, and that is how I brought in the technology of computer navigation for the first time into the Asia Pacific region way back in 2003, 2 decades back. But it was exciting in the beginning. It was a great learning tool, and we soon realized it was not offering the patients any added advantage. It is like when you want to go to a new place, you use the GPS in the car, but once you go to the place 10-15 times, you become a master. You don't need the GPS system anymore. So it is as simple as like that. And I would like to say the same computer navigation has come back in the industry in the name of robotic knee replacement. Old wine in the new cup. Well, when you look into the knee joint's biomechanics closely, you understand it is not a typical hinge joint. A hinge is a door which opens and closes. Similarly, our knee bends and extends. But the knee also has got some amount of rotational mobility. Because of this, the rotational torque forces are created, and that is not good to the knee. For example, if you see in a fixed platform knee, what happens here? The cushion is fixed into the tibial implant and the knee is made to bend like this. But the rotational mobility in the knee joint creates quite an amount of rotational torque forces, and when these torque forces act, you can see very well it is trying to weaken the bondage of this tibial implant to the bone over the years, resulting in loosening of the implant, demanding redo surgeries. But in a rotating platform implant, you can see here the cushion, synthetic cushion, is free to rotate. So this results in dissipation of the rotational torque forces into the soft tissue sleeve, and the stress at the junction of the tibial implant and the bone is almost nil. This in turn increases the longevity of the implant. As this rotating platform implant has a great proven track record, I immediately imbibed it into my practice 2 decades back. So these two techniques, muscle sparing subvastus approach and the rotating platform implant, were a great answer to the two major concerns these patients had. And due to that, I named this technique as ideal knee replacement. Yes, ideal knee replacement is a success story spanning 2 decades. I have operated thousands and thousands of patients using this technique to help them to successfully get rid of this crippling disease. Of course, brand ambassadors do not speak for us. Our knees, walking even after 20 years, stand as a testimony to our technique. In a nutshell, to summarize the benefits of the ideal knee replacement, it is a minimally invasive surgery with a very small incision. Only the skin is cut and the muscles are spared, due to which the patients retain the strength in the muscle and they are able to walk few hours after the surgery and they recover completely in 2 weeks' time. The rotating platform implant used in this lasts more than 20 to 25 years and it mimics the natural knee to the patients because it not only bends, it also rotates. Arthritis is a silent thief. Do not allow it to steal your mobility. Join the fight against arthritis with OrthoIndy to live life pain-free and walk with dignity. Thank you.